Tick-tock, tick-tock. A patient is presented to the emergency room. At first, the symptoms may just look like a controllable infection. Fever, weakness, low blood pressure. But beneath the surface, the immune system can spiral out of control. Instead of only attacking the infection, it can begin attacking the body itself. Blood pressures drop, organs lose oxygen, the lungs, kidneys, and brain can all begin to fail. Tick-tock, tick-tock. The clock still runs, now screaming the word sepsis. This collapse can happen within hours, sometimes before doctors have a clear answer. Sepsis is one of the most expensive and deadliest diseases, resulting in around 11 million global deaths each year. It happens when the body's response to infection becomes so extreme that it can damage organs and lead to death. To detect sepsis, we usually look for answers in the blood. Current blood-based biomarkers can be invasive, time-sensitive, and unclear in early phase of treatment. Doctors need a faster and less invasive way to identify which sepsis patients are becoming critically ill. But what if one of the earliest warning signals is somewhere much easier to collect? Not in a vein, not a needle, but in saliva. During sepsis, the body releases cytokines like IL-6, TNF-alpha, and IL-10, and these molecules are linked to inflammation, organ dysfunction, and mortality. Since cytokines can also appear in muscle fluids, saliva may reflect what is happening inside the body. My research aims to answer, do salivary concentrations of these cytokines measured at emergency department admission correlate with sequential organ failure assessment, SOFA score, and predict 28-day all-cause mortality in adult patients with sepsis? This study would use a prospective observational cohort study design. Saliva will be collected within 60 minutes of emergency department triage before antibiotics are given. This timing is important because treatment could change biomarker levels. Researchers will also record clinical data at admission, 24 hours, and 72 hours after, and then check the 28-day outcome. The results will also be compared with traditional clinical markers and the use of different statistical tests to answer different parts of the research question. This study matters beyond the hospital. Since saliva testing does not require needles, complex blood collection, or heavy storage systems, it may be especially valuable in low-resource countries where sepsis deaths are the highest.